Well, hello, everybody. Welcome. My name is Erika Feresten, she, her. I am the Director of Healthcare for All Los Angeles, along with Maureen Cruz. Maureen, if you want to wave. And we have co-chairs Bronwyn Major, Chang-Sim Lim, and Gina Harris. Healthcare for All Los Angeles is a local chapter of Healthcare for All California, a statewide nonprofit, nonpartisan organization. Our mission is to achieve a universal healthcare system through single-payer public financing with the goal that all California residents have comprehensive, high-quality healthcare. And thanks to the California Nurses Association, California has a single payer or Medicare for All bill. It is Assembly Bill 1400, the Guaranteed Healthcare for All Act. It's lovingly referred to as CalCare. And so we're going to start off with a land acknowledgement that we borrowed with permission from White People for Black Lives. Healthcare for All Los Angeles acknowledges the Tongva peoples as the traditional caretakers of the land we currently reside on. That is the Los Angeles Basin and Southern Channels. We seek to honor the land and the courageous people who have been its stewards, modeling a tradition of resistance, seeking liberation. We pay our respects to ancestors, elders, and relations past, present, and emerging. If you are outside the greater Los Angeles area, you can find out whose land you're on at native-land.ca. And before I move on, I just want to take a moment to acknowledge the transition of General Jeff, known and named by the people, the mayor of Skid Row. Although I only knew General Jeff for a short time, the truths that he shared with me impacted me deeply and lasting, and his impact for all that he's known and the work that he's done will continue on. So if we could just take a moment to, well, actually, I'm gonna, I just want to pull up and read what Black Lives Matter posted on their Instagram. So, let's see, hold on, let me just grab this here. So they wrote, "Rise in power, comrade, freedom fighter, lover of the people, hip-hop legend, and free Black man. Job well done, life well lived. Long live General Jeff." So if we could just take a moment to really honor General Jeff's spirit and hold his blood relatives, his blood family, his chosen family in the loving, and send them all love and light into General Jeff for his journey. Ashe. So the format for tonight is we will listen to our speakers and then have a question and answer at the end. For those of you joining us on Facebook, please drop your questions in the Facebook chat. And Jason Small, Jason, if you want to give a wave, he will ask your questions for you. And for those of you on Zoom, when we get to Q&A, if you want to drop your questions and answers in chat, I'll ask your questions for you. And then Jason and I will alternate between Facebook and Zoom. Asking everyone but our speakers to go ahead and mute ourselves. And we're going to begin just a little bit differently tonight with a reflection. So last week, Dr. Paul Song and I gave a CalCare presentation to Interfaith Communities United for Justice and Peace. And this is where I heard Stephen Fiske He's a musician, a poet, an artist, and a filmmaker. Give an incredibly moving reflection that beautifully articulates the intersectionality of all the work that we're doing for human rights. So, Stephen, would you start us off?
Thank you. Thank you for doing the good work. Can you hear me? Yes, good. Okay. So we live in a time where everywhere you look, in every facet of our living reality, we face crises that seem to propel us into catastrophic danger and existential precipice. The pandemic and the ongoing healthcare concerns, the environmental devastation of climate change, the economic uncertainties, the call to racial reckoning, the huge displacement of refugees, and the immigration crisis at our southern border, along with a predatory grasp of the military-industrial corporate complex on our lives, have brought our human capacity for achieving health and well-being into a challenge that creates an atmosphere of trepidation and disturbance. I think we're all feeling that. The imagination and the vision of democracy as governance that can serve equality and justice for the good of all people is facing a fractious undermining. It is imperative that we move beyond denial and the unwillingness to face the reality of our collective illness and dysfunction and move past the political and social polarization that impede our progress towards a healthy, functioning democracy. The call to citizen activism must embrace the immediacy of Earth stewardship, which nurtures the sustenance and well-being of the Earth and every aspect of our existence on it. This must include the social need for a healthcare system that does not impoverish people just because they become ill. The underlying motivation is first for health and not for the greed of profit margin. Parents should not be forced to choose between a paycheck and the health of their children. The care of our elderly should not drain the bank account and leave the family in unforgiving debt. Insurance providers and administration costs should not dictate a doctor's decision for a patient's care. The sign of a healthy, productive society on a sound and just social, economic, political footing is when every child can be born into a well-provided, nurturing, and loving home where security and safety are ensured, where all resources and opportunities for growth, education, and well-being are available, and where no one is outed, abused, stigmatized, marginalized, or denied equal opportunity for advancement in life. This is the basis of social integrity, fundamental to the pursuance of the experiment of democracy. We have been trapped in an unrelenting web of lies, disinformation, manipulations, and gamesmanship fed by greed and power mongering, which prey on the weaknesses and frailties of fears and needs. We are called now to rethink, reboot, and reinvent the structures of our governance and our social political reality, and to maintain and continue what John Lewis called getting into good trouble. Healthcare should be a right, not a privilege.
Thank you so much, Stephen. I love that reflection. So, and with that, I'm going to turn it over to our moderator tonight, Maureen.
Thank you so much, Stephen. Really appreciate that. And Erika, good evening and welcome all to Growing the Grassroots, Partners and Allies for AB 1400. Tonight is a special showcase celebrating our grassroots healthcare champions. Each of these volunteers who will be speaking tonight is working in their own way with their primary organizations to advance AB 1400 and get it passed in the legislature beginning this January. Each speaker will tell us why they got involved and how they are working in concert with the CalCare campaign for AB 1400. It is truly inspirational that we have so many partner organizations and dedicated allies. Tonight is our Grassroots Champions Showcase Part 1. Next month, we will be bringing more of our wonderful advocates to share their work. We hope that these unsung heroes and sheroes of the healthcare justice movement will inspire each of us to become more involved. We are fighting the industries currently siphoning $1 trillion of our dollars away, of our dollars, by the way, away from our healthcare delivery for profit. This money in the system, it's our money. Every dime extracted comes from us, and it needs to be returned to us in services, treatments, facilities, and in public health. We want actual care as the focus of our healthcare system. AB 1400 does just that by removing the insurance business middleman from the system. We have little time and the lift is heavy, but growing the grassroots together, we can succeed. This evening, we're going to hear from just the folks who will tell us how they are contributing in the effort to get AB 1400 through the legislature and establish a just, equitable, fiscally responsible, and morally grounded healthcare for everyone in California. So the first person was not able to be here. She's Isabel Story from Indivisible California's Health. She's a facilitator for Indivisible California's Healthcare Working Group, and she's a CalCare AD 50 leader along with Gina Currie. They are a team, but Isabel first sent us a video where she is sharing her thoughts with us. So we'll see that first. Paul, we don't have any sound.
I think that achieving healthcare for all is one of the most important things that we can accomplish in our world today. As after all, what is more important than our health? I really became active in politics after the 2016 election when I felt our democracy and our whole way of life was being threatened. I worked on a number of issues and campaigns. But after our pivotal gains in 2018, I did feel at that time it was important to move beyond getting people elected. We had to hold their feet to the fire and make sure that they delivered on the progress that we wanted. And the pandemic convinced me more than ever that tying healthcare to unemployment was simply unworkable. People were losing their jobs and their health insurance at the same time, and just when they needed it the most. So I felt that here in California, where we lead on so many progressive issues, we actually had a chance to get single-payer healthcare passed and then to be a model for the rest of the nation. To that end, I'm involved in a number of organizations. I'm going to tell you a little about each one. Indivisible California, the California Nurses Campaign for CalCare. I testify regularly at the Healthy California for All Commission. And I'm working to get local resolutions passed supporting AB 1400. So let's look at these 4 basic activities and see how you might get involved as well. As part of Indivisible California, I'm head of the Health and Reproductive Rights Work Group, and AB 1400 is right now our top priority. Indivisible, you might have heard of us. It's a nationwide grassroots movement made up of thousands of local groups that advocate for progressive change. Here in California, Indivisible State Strong is made up of more than 80 groups. Every year we vote on our priority bills and advocate for them throughout the year. My healthcare and reproductive rights group followed 4 bills this year, and with our top priority, as I said, being AB 1400. If you'd like to learn more about Indivisible, you can visit the website, just Google Indivisible Guide. There you can enter your zip code and you will find the Indivisible groups near you. There's at least one in almost every congressional district. So right now, as part of our advocacy, we're working on getting local resolutions passed endorsing AB 1400. This is part of a larger California-wide effort that another speaker tonight is going to be telling you more about. I wanted to let you know, as far as our Indivisible group, we're participating in the effort to get this passed in Los Angeles County. And I personally am working on getting a resolution passed in Santa Monica. Other members of our Indivisible group are working on resolutions in Sacramento and San Jose. Now, moving on to another thing I'm doing, which is on behalf of both Indivisible and the California Nurses Campaign for CalCare. This is making public comments at the Healthy California for All Commission. This commission, may or may not have heard of it. It was created about 2 years ago by Governor Newsom, and its mission is to move us toward a new healthcare system in California. And they're supposed to deliver their findings to the governor in January. So we want to make sure that what they deliver is a healthy endorsement of single payer and AB 1400. They're meeting just 3 more times, November, December, and January. And there's an opportunity for public comment at every meeting. You can sign up with the Nurses Campaign for CalCare. They will notify you of the upcoming meetings. And then you'll also be invited to some prep sessions where you can help prepare your comments. So we will be posting a link for that in the chat. If you're interested in that, please sign up. And finally, I'm just going to touch on my work as a CalCare district leader. This is with the Nurses Campaign. My fellow district leader, Gina Currie, is going to be telling you more about that. But I did want to let you know that we are having a phone bank 1 week from tonight. And we are going to be calling CalCare supporters to sign a petition, which will be delivered to the legislature before they vote, and also getting them to call their assembly members. We'll post a link to the phone bank in the chat. And also, if you haven't signed this petition yet, please just take a moment to do it now. You'll be adding your voice to more than 10,000 people who have already signed and helping us get CalCare for California. Thanks so much.
So thank you to Isabel, even though she's not here right now. And her partner is Gina Currie, who is a CalCare leader for the 50th Assembly District. Welcome, Gina.
Thank you for that introduction. Thank you all for the opportunity to present and speak with you tonight. And I also like to thank the National Nurses United and the California Nurses Association for assisting me with the inspiration to find my true voice and my true gift that I bring as a registered nurse. As a registered nurse, I've provided and touched the lives of so many people for the last 40 years. And 40, the number is very significant. And I've been lately connecting with that number. And there have been several historical events centered around 40 years. So with that backdrop in mind, I'd like to first state that all my statements are my own and they do not reflect previous employers, current employers, or my nursing training. I'd like to let you all know as well that as a nurse for the past 40 years, I've been, the gift within me has been boiling up and expressing. As I mentioned, I've taken care of many people. My patients I've served have been from the cradle to the grave. And I've worked from the inside of the hospital setting to the outside of the hospital setting. to the public arena, as well as over 7 to 8 different states within the United States of America. It's with that experience that is coming forth that has called me to the National Nurses United and the California Nurses Association in this area to be able to express this gift. My primary emphasis has been in Medicare for All as a nurse supporter because of my love for nursing and my love for people. I joined the Medicare training school, the leadership school, and that is where I really developed and honed my voice and my story. And in that story, I bring out my leadership skills that I have been provided and taught and learned through several schools, but most notably through contemplative practices as a healer. And as a healer, it's very much time now that I could bring that voice to this experience. So as a nurse healer, I started reaching out as well to my communities where I lived and worked and served, developing wellness practitioner skills of teaching, assisting individuals to hone practices that they would learn for self-care. I never realized the importance of this and what it was doing because it was teaching me of what's necessary for me to bring this gift to Medicare for All, healthcare for all. Being in California, I was asked then to work with the AD 1400 CalCare, although my primarily focus was in Medicare for All. Since California right now is focused on this AD 1400, then I became or was asked to become a leader in the AD 1400 as part of my practicum through the leadership training that I received from National Nurses United. My wellness practitioner activities then allowed me to connect the fact that as a nurse, I know what the cure is for healthcare, our broken healthcare system. I've been working from the cradle to the grave, trying to bring about the change. And I can only say that after 40 years of experience, I know the answer is healthcare justice, and it must be brought for all. Nurses, we're trained to provide care for everyone, regardless of the circumstances of where you're from or how much you can spend for your health care. So that drives me, in that I've been working to provide care for everyone. However, our care system does not do that. We're largely focused on as a commodity, our health. This commodification is hurtful for me. That's where the healing must take place, and to remove the commodification so that we as true healers can provide the healing that people are coming to ask for, and especially in this time as reflected in the reflection that was shared before we spoke. So that is the impetus, and it's coming forth, and it's coming forth from where I started, what I have been called to bring, and I am bringing that now to this platform of healthcare justice through Medicare for All, and by extension, CalCare AB 1400.
Thank you so much, Gina. That's
Yes.
wonderful. We really appreciate it. And thank you for all your work in the 50th AD, because we really need it.
Yes, stay tuned. Follow me, please. You can look up my website and you go there to Gina Currie, curerx.com, to find all the events related to my activism: phone banks, text banks, petitions, days of actions, Medicare for all, and the support staffing and nursing advocacy. Thank you.
Thank you so much, Gina. Really appreciate it. Really appreciate it. Next, we have another tag team here, Michelle Verne and Betty Doumas Toto. And we'll hear from Michelle first. And Michelle and Betty, you can tell us what groups you're with and what you're doing and how we can become involved with you and be supportive in solidarity.
Great, thank you. Thanks for having us here. It's a lot. So first, the club, I'm president of Field of Bern, San Fernando Valley. And the club is really focused on doing actions to get the community educated on AB 1400. So what we're doing is we're doing light boards for CalCare, and we take these light boards that say, do you CalCare and AB 1400 to the North Hollywood Metro Station on November 5th and 12th from 6 to 8. We pass out information about CalCare, talk to people about it, and have them do the solidarity project that we're working in conjunction with Single-Minded for Single Pair with Betty with. And we have actually these lights that you can actually put on your cell phone and take the picture petition right there on your cell phone. So we're going to take those out there on November 5th and 12th between 6 and 8 p.m. And I think Betty's going to put the link in the chat. If anyone wants to join us, come and join us. It's fun, and it's we get a lot of positive reaction. And we also pass out these CalCare lollipops. I'm actually eating one right now. They're really good. Wait, can you see it? Oh, shoot. Okay, there we go. See, there you go. And then there it is. Oh, there it is. And on the wrapper, there's the QR code to take the petition and the link to go to. Okay, so then my son is here. Kason, he's a student volunteer with the club. Wait, you can't, he's kind of, okay, there he is. And him and another student volunteer, Logan Fisher, are going out to the colleges and canvassing and getting people to do the solidarity project and passing out these lollipops. And he's recently decided to take his lightsaber, his like really expensive lightsaber out, and people have been taking pictures with it, drawing a crowd. So that's helping. He's gotten a lot of people to sign and take the picture petition by doing that. The next time they're going out is November 3rd at CSUN at 4:30. And they go out twice a week. So I just have to make sure to keep the events updated because it's hard. So then what else? Also, we have CalCare postcards that we're sending out. And there's a form that you can sign up to get them. We used to ask for a $20 donation to send them out, but we need to get them out ASAP. So Betty's going to put a Google form in the chat. We will send them to you. We will get them to you if you will just mail them out by the second week of November, I would say, third week of November at the latest. And we send the stamps, we send the talking points, we give you the list of people to send to, and the people that you'd be sending to are all in District 45, which is Jesse Gabriel's district, he's one of our target assembly members to try to get to sponsor the bill. So with that, if you want to fill out postcards for us, the link is in the chat. And there's that. There's also, we've created a CalCare song, and it's the lyrics have been recreated to match "Staying Alive" by the Bee Gees. And we plan on doing a music video to it. We're trying to get everybody to sign up to be in the music video. And I believe Betty's going to put that Google form in the chat. If anybody'd like to be in the video, come and join us. You don't necessarily have to be an actor in it. You can just, you know, be on the sides. You don't necessarily have to do the dance, because we do have a CalCare dance too. You could just be in the video. The more people, the better. So you can fill out that form, and as soon as we get enough signups, we'll be setting up a date to record that video. And Betty, is there anything I'm forgetting? I think that's it. It's a lot. So, and then stay tuned for more things in December. Betty, are you there?
Thank you, Michelle. Fantastic. I don't know. There's no end to the creativity that comes out of the Field of Bern, San Fernando Valley. That's for sure. The lollipops are the latest.
We're gonna.
Wonderful. Betty, I know you've got some things to say to us as well.
I do.
Thank you, Kason. Thank you, Kason.
Yes, Kason, blowing up my phone with the notifications that people are signing up for the CalCare project. Every time him and Logan are out, my phone gets the notifications, and it's like, and then all of a sudden I'm like, wait, why are so many people filling out that? Why am I getting notified so much? And it'd be ding, and then I'm like, oh, it's like Vegas here. I got the jackpot. You know, everybody's signing up. Ding. So yeah, they're doing an awesome job. Thanks, Michelle. Just to let you know, I was busy dropping all the links into the Facebook, and I also did them into the chat. So I'm multitasking as usual, as I usually do. Anyhow, you know, thanks for doing this, HCALA. This is really awesome. There are so many people doing so much work there, and to kind of get us all together and let each other know what we're up to, so that we can best communicate with each other and support each other, because you know, we all need to support each other. You know, there's going to be stuff that you know, what is that saying? More hands makes a lighter lift. And, you know, and I think that we can, you know, it's sad when people don't support you and you're doing such a great job. So, yeah, so I have a few things that I'm going to discuss per request of Maureen. And I think I'm going to start with the CalCare Solidarity Project. And tell you a little bit about that. I'm also going to give you a timeline on what's happening out of CNA. So we have an idea of what's happening over the next few months. And also I'll give you a little update on Los Angeles County Democratic Party, what they're kind of, hopefully they take up in the next week or two. But starting with the CalCare Solidarity Project, it's a concept and it's a tool, and it's to support AB 1400 CalCare and to support people like us that are getting out there and doing the work. It is housed on a website called Single Minded for Single Payer. And as a few of you know here, that's something that I use, a phrase that I use about myself, that I'm single-minded for single payer. I don't know if it's to a fault at times, but yes, I am. And it's basically, it's a design of my own. But the impetus was the people around me. Chris Shimizu, for one, who kind of let a light bulb go off in my head and kind of got me down the rabbit hole of creating it and getting it put out there, and support of Michelle and Jason Small and everybody that are always behind we're all behind each other, helping each other and uplift each other in this work. And we have a Field of Bern, San Fernando Valley, a Single Minded for Single Payer. All of us have made it a priority legislation. So it came out of McAlevy's Workers Rising Everywhere seminars that she did.
I took I think it was a 6-week course. Michelle took it, I took it, Chris took it, some other people took it, even HCALA members took this course. And it was really for union organizing. It was a little difficult to translate into community organizing, but we did it. We translated something into it, and out came the CalCare Solidarity project. So, it is really simple. It is a photo petition. That's basically what it is. That is the juxt of it. That is the focus of it. Housed on this website, you do get more information about CalCare. You get the nurses' points, talking points, everything else. You can book an information session where we will come and tell you about it, and also tell you about actually using the CalCare Solidarity Project tool, which is the petition. And once we get enough photo petitions in any particular district, whether it be an assembly district, the Senate district, a state Senate district, we will take it on our legislative visits. And we will take it and to the legislators, and basically to show them this is the humanity behind AB 1400. These are the people that are supporting this, and supporting this legislation is supporting these people that are constituents that vote for you, that are in need for this, especially during this pandemic. And yes, we are still in a pandemic. We're doing a little bit better, but we're still in a pandemic. And so it's a strong visualization. The unions will do this at times when they go into a workplace and they get people to sign up to unionize that workplace. They'll take photos of everybody, and then they'll walk up large posters or banners up to the bosses and say, we want to unionize. And this is basically the same concept with this, is we want you to pass this bill. So we are asking in the petition, we ask that people put their legislators' names, and there's a location there where you could do that. And you could find the legislator right there. There is a place where you will just check off a box that says, I want my legislators to prioritize and co-author AB 1400. And then a little checkbox giving us permission, of course, to use the photo. And we use the photo basically, like I said, to take it up, put it up on a poster board, put it up a banner, bring it to the legislator. But we will also use it on social media to tag the legislator and say, so-and-so CalCares, do you CalCare? So-and-so assembly person, so-and-so senator, to get that attention and bring attention on an ongoing basis for the legislation. I don't think that this is finite in any way, because I really do believe that moving forward, we can use this, of course, as we move down through this bill. If we get it to the Senate, we get it to the governor. More and more people get a sign on, the bigger that this banner looks. I'm hoping that it will be a quilt, because I believe that we can make it a quilt of faces. And I think that will be a strong thing to put across the lawn at the Capitol. Faces of everybody for CalCare, and hoping to work with a textile artist that I do know. I haven't talked to her yet, so if you're listening out there, I'm hoping that she will help me design something to do something like that. And it's an easy tool to use. Does everybody have their cell phone with them? Or I hope they're not on the cell phone, but if you have your cell phone close to you, I think I dropped it in the chat, but if you can open it up, your phone to this, did I put it in there? No, not yet. Let me do it. I see your message there, and I haven't gotten to everything. So let me just go right here, and I'm going to quickly go. Okay, so I dropped in a link for the action page. I'm going to share my screen real quick with you guys, if that's okay. Can I do that? Yay. I'm going to open it up. Okay. So I'm sharing the screen with you, and basically on your phone, this is great to do when you're tabling. This is great to do in the supermarket. This is great to do on the bus. This is great to do wherever you are. just open it up, and especially on your cell phone, it works just like an application. You go to the project action, which I gave you the link for specifically. You click the take action. There's a little video here that kind of shows you exactly what we're supposed to be doing, like I explained, and so I just go. So you have an idea of what we're thinking of finalizing with. Okay, come on. So everybody's faces appear, and we're hoping that we get everybody's faces propagated to big banners like this. But the solidarity petition is easy. You could sit there and fill out their name with them. Like, so if you're tabling, you just fill out their name with them, their zip code. You have here, find their legislator. You could put their legislator here. If they can't do it, if you want to be quick, just put their zip code there. They're basically agreeing to this. I, the constituent and signer, am supporter of AB 14 CalCare, and one my state assembly member and senator, as named in the previous question, to become a co-author of the legislation and prioritize. You click that, and you click the permission to do so. I'm going to put a test in. The phone, you don't have to do, the phone is not required. The other ones are required. So you won't be able to skip anything that is actually required. And then you'd hit upload the photo. Now, for me, I could pick any photo that I want from my computer. So if so I don't have to take the picture exactly. But if you're on a phone, actually, it actually accesses your camera. So when it accesses your camera, you could do a selfie with somebody right there and then. So you're on your phone and you're signing them up at the table, and it takes their photo. Now, we're hoping to share all this information with our district leaders, of especially those targeted assembly people, then as targeted senators, so and so and so. And then if an organization wants to do this, but they're concerned with the information, we can actually, I have only a certain amount of time, but a certain amount of space, but I could do their own page where you have your own petition, and it'll go into a separate form, which would be shared with you. And
Thank you, Betty. That's fantastic. I know you have things to say about the LACDP as well, but I believe Sean is going to say some things about that, and then we'll have a discussion, and I'd love for you to join in then.
Yeah, sure. I'll just, if we have a little time, I'll just go over the time frame, like I said, for the nurses and what's going on with the task force.
Yeah. Okay. Can you do that in 1 minute?
Oh, yeah, pretty much.
Okay.
It's pretty much just, I'm just going to read it. Okay. So happening now, virtual phone banks hosted by district leaders like me and Michelle, like Gina, like Isabella. So they're happening right now, and you guys also do them. So we know that. So online texting team is finishing texting the remaining priority districts now through November. District leaders are now contacting assembly offices and scheduling visits with the legislators, and the visits will be between November 29th and December 17th. That's the prime time that legislative visits will be held. And then moving on from there, we will, as district leaders, have like a preparatory type of, thing for this, and we'll bring that information along. December, tentative in December, they're going to have a statewide strategy call. They're also going to have virtual postcard writing. They're going to have a CalCare Day of Action, tentative for September, January 8th. And we will have phone banking starting the first week in November. As Gina already said that she has a phone bank scheduled. We will get our information as district leaders out to you guys as soon as we schedule those on. The legislative timeline based on last year is January 4th, legislation convenes. The 14th, the deadline to pass healthcare committee. 21st, deadline to pass appropriations. 31st, deadline to pass assembly floor. And so those trainings will happen in November 10th. So we'll have the legislative visits that first week. as for LACDP, as you know, Mark Gonzalez, he created a task force on AB 1400, which has not really met more than once. So I kind of pinged them about a month ago and said, we need to get moving. And I'm hoping that they pick up the CalCare Solidarity Project for all of the people at LACDP to do the petition and hopefully to move that on to their Democratic clubs throughout the county. I'm hoping they pick it up. I hope the committee says, yes, we could do that. So that's where we're at right now.
Thank you so much, Betty. As always, you are an incredible wealth of information. Yay. And Michelle as well. You guys are so creative. Thank you. Next, we have a new member who's interested in pulling things together. He's at our meeting before this meeting. Shigeru Julio Tsuha is here this evening, and we'd like to welcome him and have him tell us all what he's about to do.
Thank you, Maureen. Hi, everybody. I'm Julio Tsuha. I teach sociology at Pierce College, which is one of the 9 colleges in the LA Community College District. I'm also a proud member of AFT 1521. So I'm with my union and I'm part of the Social Justice Committee, which we see it as our task to bring progressive ideas and conversations to our membership, to make our union to be more about social justice kind of things that really affect our entire community. I want to say thank you to everybody for letting me be in this space, inviting me, and just to say how energizing it is to hear about everything you all are doing, which what we're doing might not seem like much compared to, but what we are doing is we're putting together an event on December 2nd from 3 to 4:30 p.m. And this event, we're inviting speakers on universal healthcare, AB 1400, to come speak not just to our members of our union, but really to our entire community college community, including our students, to learn about what universal healthcare really is all about and how important it is. Let me tell you a little bit about why this is so important for me, which is a little personal story. I came to the United States in 92. My parents followed in 95. When I was in high school, basically my sophomore year, my parents are making minimum wage jobs part-time. And like any other high school student, I'm playing soccer. I'm sitting in the back of my biology class, except that every month I found myself getting closer and closer and closer to the front because I couldn't see the board, the writing on the blackboard anymore. And when your parents don't make that much money, you kind of just don't tell them you need really expensive stuff because it's just not a conversation you want to have. But at some point you can't see the blackboard, you tell your parents and you make this face that not parent should ever have to make. But of course they're like, well, we brought you here to be successful. So here's whatever money it was. I don't remember, it was tons of money because they didn't have insurance to go get glasses. And of course, in one of my first soccer games after I got my glasses, I took them off and what happened, right? Anyways, so this was the story. 2 years later, 97, my parents get into UCLA to work food service. Ask me $32.99. They become union members. And like that, it felt like we were finally part of American society because we could afford to go to the dentist, because we could afford to go get glasses, just stuff like that. So I felt like I owed a lot to the union movement and became a very strong union person. In college, became a union organizer. And then I got into education. And that's the thing about education, that for me, education did this thing which it took this crazy thing that was called society that I felt completely disempowered in. And I just felt like a little fish trying to navigate the whole thing. And it broke it down. And all of a sudden I felt like, oh, this is how stuff gets done. And this is what you can do about it. And it didn't feel like a puzzle anymore. It felt like something you could engage with. And that's basically what I'm trying to do with my students. And that's basically what I'm trying to do with the union. And that's basically what the Social Justice Committee kind of engages in AFT 1521, which is trying to find ways to connect these personal stories, trying to find ways to make sense that to our students that the world, society is not just crazy, it's not just chaotic, but that there's this labor movement with a history of social justice, even if sometimes that doesn't get publicized today. Like there's this very strong connection. And it's really important to bring that back, to bring it to light, to make it happen. And at this event, we hope to take a step furthermore in this direction, because we are at a moment when we can achieve something great that's not just for union members, it's for our entire community. And education is a really part, maybe the first or not the most important necessarily, but certainly the first step there. I think the most important step is actually what's happening in this room right now and what's about to happen in the next month or so. So December 2nd, everybody's welcome. Thank you so much for bringing me and being letting me be part of this. I'm very, very grateful. Thank you, everybody.
Thank you so much, Chigueru. We really appreciate you, and thanks for sharing your story. I just saw that happen to a little girl last weekend. Her glasses dropped off and she stepped on them in the soccer game. So interesting. Next we have here DSA and PANA members are in the house. We have Steve Gibson. Steve, welcome again. And tell us all about the tabling that you're doing and the resolutions and anything you want to tell us about PANA or,
Yeah,
or DSA or anything else.
Thanks so much for inviting me. Yeah, I'll just talk about myself a little bit. My first experience in the healthcare system was being on Medi-Cal back in when I was in my 20s. I was in a car accident, and we had little stickers, Medi-Cal stickers, to pay for the medical care. And since then, my political involvement has kind of straddled two facets. I've been an administrator and an organizer. I was trained by Fred Ross Sr. in farm worker style organizing. I worked as an administrator at Health Access back in the 1990s when Marianne O'Sullivan was the executive director. I set up the membership database for them. I worked at AARP as a healthcare organizer during the Clinton Healthcare Reform Initiative back in 1993. I've been lucky most of my life. I've been able to get paid working for nonprofits and political organizations. A big eye-opening event for me around long-term care was when my mother became bedridden. My wife and I became unpaid caretakers and used all of our funds to cover the gaps in care for her beyond Medicare and SCAN. It showed me that one flaw in our healthcare system. I recently went back to school, finished my PhD in education in 2019 before joining the Bern campaign as a regional director. I'm now glad to be volunteering with DSALA, Healthcare Justice Committee, and PANA, Progressive Asian Network for Action on healthcare, working on healthcare now. I came to healthcare justice reform from the angle of equity. I believe our system suffers from racial, ethnic, and social injustice and inequity. I say we don't have single payer healthcare in the US because of the endemic racism in our country. When we look at healthcare inequity, we identify race, place, and power. The race or ethnicity of patients, the place or zip code where the patients are, and the power differential between patients and providers. I'm going to put a few links to some studies in the chat that talk about inequity in our healthcare system. And I just have one quote to read from the California Pan-Ethnic Health Network. California's communities of color, including LGBTQ+ individuals and persons with disabilities, continue to experience discrimination and have poorer outcomes on key health indicators, including asthma, diabetes, and mental health than other Californians. Despite individual actions and intentions, our healthcare system, as designed, often makes health outcomes worse, particularly for communities of color, by perpetuating the very inequities it seeks to address. So that's a quote from their study, one of those linked in the chat. So I've recently been tabling for AB 1400 CalCare at farmers markets in San Gabriel Valley each week for DSA LA. We've talked to hundreds of people over the past few months, and we're continuing on Wednesdays and Thursdays. We're at Altadena Farmers Market and South Pasadena Farmers Markets. We came up early, talked earlier a little bit about PANA and the other Asian allies who've worked and protest and lobbied and organized with support from many of you on this call to support the seniors in the care homes who the owners want to convert to market rate housing. And I mentioned that coalition that formed called Save Our Seniors. And SOS activists say the behavior of the owners of these Japanese nursing homes are continuing the pattern of violence toward Asian Americans that have been heightened in America these last few years. So thank you very much for letting me share some of the things I've been doing. I'm glad, we have other people in the room who will talk more about what DSA LA Health Justice Committee is doing, but thank you for letting me share time with you.
Thank you so much, Stephen, and thanks for sharing a lot of your background with us too, because I didn't know any of that. So thank you. And yes, you led right into someone who's going to tell us more about DSA LA Healthcare Justice Committee. And that would be one of the champions of Healthcare Justice Committee, and that is Sean Broadbent. Hi, Sean.
Hey, everybody. Thanks so much, Maureen. So sorry to have missed Isabel's story, Gina, Currie, and Timothy Byer in the first part of Michelle Verne's conversation here this evening. But, it truly is such a big coalition for CalCare here. And, Los Angeles has the largest delegation in the legislature. So we need the biggest movement possible to win all these votes. And, our legislators know that they should be on this issue again and again. It polls the highest possible to where this is something that is an obvious winner for them. But we know that they've got a lot of pressure from the 1% against them to make this obvious move to support universal Medicare for all, or in our state, single payer, as embodied by CalCare. So we want California to move first. We want it to be a state that finally realizes single payer in the United States, and we think it can. But regardless, we do see it as our place to fight for single payer. So whether or not the legislature is going to move on this, we're going to fight for it and hold them to the fact that this is the right move to make and something that they should do. So actions that we've taken throughout the year in support, the nurses, the California nurses have been incredible in offering tools for us to bring to the chapter to create actions, and we've participated in them. We currently have members as district leaders in 3 assembly districts. That's a good start. It's helping us doing the texting and phone banking that is laying the groundwork for initial pressure on the legislators, but we want to go further, right? We want to actually have a ground campaign for CalCare, and that's what we intend to do. And it's something that Stephen has already been doing and kind of workshopping and showing us the way on, setting up at community markets, doing that early bit of canvassing. And we want to take it into all of the assembly districts where we currently have district leaders And we want to pair it with a door campaign as well, because we think that that takes it the next level. Meeting somebody at the door to answer your questions on an issue that you already care about, but somebody who's going to help link you to the action that you can take for it. We think that's incredibly persuasive. As good as the phone banking and the text banking is, having people at the doors in the districts that matter can make the difference in these tough committee hearings that are coming up in January. It's a quick turnaround. We have so little time to move through the legislature and get this bill through. So we are going to hit the ground running. We next meet November 1st. So that's where we're going to really lay out the campaign in the committee and get our comrades active on this. We have a chapter of some 4,000 members. We are looking to get them energized by this. We had a very enthusiastic participation with the presentation made at our chapter convention. So we want to capitalize on that and get people involved, because it's something they've told us they're concerned about. So our job as the Healthcare Justice Committee is to give them ways to take action on it. Make it easy, make it something they can show up to, and that they can put a 2-hour shift in, or a 3-hour shift or a 4-hour shift. We won't ask for much more than that unless they want to be a Canvas lead, in which case we're talking a 12-hour day. But you know, that's for the real diehards out there, which of course are in this room. So just, I don't want to go too much more. I think you did want me to talk about action that we're taking within the CDP. So the California Democratic Party, DSALA made a play for putting our membership into the CDP. And we won quite a few races, including the slate that I was a part of in my district for 8043, had almost majority DSALA members win. So we're in the party now, and we're advancing our perspective within it, a socialist critique, and we're taking action. So we know that threats exist. We know that we're pushing for single payer, but we know others are going to push for public option. We know other people are going to push for a false version of single payer, where there's still contracting entities. So we're pushing on CalCare, and we're holding the commission particularly accountable. Put forward a resolution for the November e-board that will call on the Healthy California Commission to endorse single payer in its proposal that will be put out in the new year. And we know that that's already where the party is. So we're reminding them of that, that the party endorsed AB 1400. It has single payer and calls for it in the party platform. So there's no reason the Healthy California Commission should avoid endorsing single payer in its proposal without any of these entities, the risk-bearing intermediaries that make it harder and more expensive to access care. We particularly got signatures for this resolution from fellow assembly delegates who are in the district for members of the commission. We think that sends a strong message to those committee members, particularly Jim Wood. We got every one of his assembly delegates from his district to sign on to this, to say, listen, we see you, you need to see us, and you need to hear us. So that's something we're pushing within the party. But I'm particularly excited about what we're going to do here in LA County together. And it's just a lot of fun. This is a great group. So thanks for having me on to talk for a little bit.
As always, Sean, you are awesome. Sean just came off of another meeting just before this one, by the way, where he was presenting a major PowerPoint. So he never stops. So I guess we could see if we have any questions from Facebook or from the Zoom. And if not, perhaps we can open up a conversation among these fabulous champions who just presented to us. So do we have any questions yet?
I do not have any questions from Facebook at this time.
Okay, Erika, Anything yet? No. Okay. Betty, I know you wanted to weigh in on the Democratic Party situation.
Yeah, I did briefly. Mark Gonzalez, he from the Los Angeles County Democratic Party, and you know, Feel the Bern Democratic Club, which I am a member, which many of the members we work closely together on, and this is our priority legislation. We were elected as LACDP, county committee members, and then because then we get appointed to be California Democratic Party delegates. So, for the next 4 years. So we kind of we were able to really get for this little group that just started, we were able to get a little bit of a stronghold of several of our members, elected. That Mark, he did the car caravan. He came out in support of AB 1400. He spoke at the March for Medicare for All for AB 1400, and then he created a task force for healthcare for Medicare for All. We did have one meeting, and it was with Ash Kalra, but we hadn't had anything recently. So in order to spur them on to do something, because time is running out, about a month or so ago, probably like 6 weeks now, I kind of pinged them and say, would you like to just take this on? CalCare Solidarity Project, take it on. Just let's move people, get people, moving, involved, get their, support out there. So I'm still waiting to hear back. It is very slow moving, and hopefully we do hear back from them and we can get this, rolling. So that's pretty much on that front. It's this year, I believe, is a policy, a platform for the CDP. I don't think it's a resolution year. I think it's a platform year where they work on the platform. And, we need to keep our ears and eyes open. I only have so much bandwidth because, as you know, the last time they tried to strip single payer off, and that's why it was 2019, November. And as you all know, we all went into that meeting with full force and ready to make sure that they did not strip single payer off that platform. So if anybody knows anybody that's on that committee, make sure that they're not, if you have any heads up, that they're not trying to change any of that language because they tried to do it last time.
Thanks.
That's a bit for that.
Sean, what do you think the possibilities would be for your campaign, your canvassy campaign, to be adopted by the LACDP? Any chance there of pursuing that?
I'd have to touch base with somebody who's been involved longer, because it's my first go around, so I'm learning a lot. But if somebody wants to connect me with who we talk to get the wheels rolling on that and to get them officially involved, then of course would love to have the participation of a much larger group willing to commit to it.
I think Betty might be that person.
Gina Harris is on that task force as well. Listen, we need to do whatever we can. So whenever they decide to get this meeting going, I will put it out there for sure.
Well, yeah, please let me know. And is it just for?
It's just for the task force members. Or? Yeah. It's not for CDP. It's just for LA County delegates, and it's a task force made of the members that were appointed to that task force.
Well, if you need to rehearse your talking points going into it, or do
I'll definitely get all of your information and say we need to get together with other people that are like-minded on the issue. We need more people. So for sure.
Okay. Does anybody else who's presented to anybody else on the Zoom have anything to say, or any questions? Anything you want to explore further?
I have a question. So grateful. Betty, you and Gina are on that task force. Betty, I'm wondering, with the enthusiasm that Mark Gonzalez has shown, with speaking at events and creating this task force. And he's very well, he knows how the whole party and legislative process works. Mm-hmm. Do you have any insight as to why this is taking long? Why only one meeting? Because I feel like, time is of the essence. It's urgent. Do you have any insight into that?
I don't really have any concrete answers for you.
Okay.
I can only speculate, but I don't have any concrete answers for you. I will say that I believe that the recall sucked a lot of the air out of everything and anything, and not just this task force. Okay, not just the things that are happening. I'm talking about everything across the board. That it basically, anybody that, even candidates, their own candidates, other candidates that were running, for state assembly and this and that, it sucked it out of that too. So I have to say that is one of the huge glaring things that I could say. Other than that, it's just speculation, personal speculation.
Okay. Well, I guess we can actually end this meeting.
Carol had a question.
Oh, Carol, you have a question? Sorry.
Well, it's getting late, but this is something to think about when we're talking to people about CalCare. I understand that Californians are most concerned about homelessness. And I think if we can make the connection between homelessness and lack of health care, that might help bring more people on board. So it's just something to keep thinking about when we talk to people. Thank you.
That's a great idea. And in fact, we did talk about having a session, since our monthly meeting is just once a month. Office hours seems like a very good opportunity, because it's well, I'm not sure if we're still doing every week. Are we still doing every week? Erika, are we still doing every week office hours?
Well, we're not doing this week because it's Halloween.
Oh, yeah.
So the next one I think is December 7th.
So perhaps we can focus on that. I think that's an excellent idea. I'm sure everyone else probably thinks it's a good idea too. I'm just looking around. I think you do.
I'm just, if I can add that this weekend, if you're in the Los Angeles area, there is going to be a dystopian house of disorder. I guess you could put it.
Horrors.
Dystopian
okay. House of horrors.
Of horrors. And, I think that Healthcare for All Los Angeles is going to be there representing and telling everybody how dystopian it's really going to get if we don't pass Medicare for All and AB 1400. I know that the CalCare Solidarity Project will have a photo booth set up there to take people's pictures and get them signed up. So I don't know, a little zombie action maybe. I don't know. We'll see.
Wonderful. Maybe Paul, can you put that bit.ly in again for the dystopian? We did discuss it at the prior meeting, but this is a good time.
We're on live stream, so yeah.
That's a great announcement, and Paul's going to put the bit.ly in for this weekend. Jackie Hernandez is very involved with it. Jackie, did you want to have anything to say about it again, since this is a separate meeting?
For the haunted house, right?
Yeah.
Yeah, so basically right now we are setting up, so we're going to be setting up for the weekend. I'm going to be there on Tuesday and Thursday from 7 to 10, and we're just hoping volunteers can show up to help us set up. And we're looking for actors to come and dress up as our medical dystopian providers. So yeah, so we're looking for people who can also act on the 29th, 30th, and 31st. But if you want to come as guests as well, like letting you know, the 29th, 30, and 31st. I'm going to be there pretty much the 31st mostly for sure, and the 29th. So say hi. And I know that Betty, you're going to be there too. I forgot which day you're going to be there, but
We're going to
I'll
be
see you
on
there.
Saturday.
Yeah, I'm not going to be there on Saturday. So Betty will take it that day. She'll represent HCLA that day as well as Michelle, right? Michelle Verne's going to be there too. So I'm excited. It's going to be a lot of weird stuff, right? We already have a weird healthcare system, so it's 10 times worse.
So
Made a menu.
All the public out there, show up to the Bernie's coffee shop that will be turned into a dystopian house of horrors. Figure out so that you can see what our future looks like if we don't get this progressive issues passed. We get the legislation passed.
And the Bernie's Cafe is on the corner of Fairfax and Wilshire. And Wilshire. And the hours for this weekend are going to be what again?
For Friday, it's going to be from 7 to 10. And it's also in the flyers. So you're going to be seeing the flyers, wonderfully done by Bronwyn. I'm so happy to display those. They're so amazing. So we're going to be having like climate justice as well there. So we're going to be having also the 4 conditions of warehouse working and the Billionaires Lounge. So yeah, it's going to be really fun. And I'm really hoping to see you guys there. And supporting. Yeah, what else can I say about that?
That's wonderful. So already, if you think about it, we already have this weekend, Friday, Saturday, Sunday, then November 1st. Sean, you're having a DSA LA meeting. Want to give us a quick update on that? And it's good to say this verbally for the people on Facebook who don't see the chat. So
sure thing. So you can visit our calendar at dsa-la.org/calendar/month. And we will be meeting November 1st in the evening, 7 p.m. to 9 p.m. Adding a link here. And I'll also go ahead and jump over to Facebook and drop it there. We'd welcome you to visit, introduce yourself, kind of get to see what we're about, and consider joining DSLA.
Great, thank you. And then next up, just 4 days later, we have Feel the Bern San Fernando Valley with Michelle Verne and entire crew. Michelle, you want to give us quickly again the information for November 5th and November 12th for your actions?
Sure, that's at the North Hollywood Metro Station from 6 to 8. And also, I wanted to say, I'm sure you all probably know, Feel the Bern is hosting Senator Nina Turner on Friday night at my home, an evening with Senator Turner. She is going to discuss AB 1400. That is on her list to discuss. And then there'll also be several candidates in the LA area there speaking. And it starts at 6:30. And I have the link somewhere, but anyway. Yeah.
Thank you. And I see there's a hand up. Francis, you have your hand up? Would you like to unmute?
Hey all, excited to introduce you all to, well, you all already know candidate Jetro Elise, who's running for the State Assembly in AB 36 against Tom Lackey. I am his new campaign manager, and I couldn't be more happy and proud to be so. He's an incredible candidate. He's actually here on this Zoom call right here. We're in 2 meetings at once. I'm in 2 meetings at once. But we're making this thing happen, and we're so happy to have your support already, having your endorsement. We as I've gotten to know Jetro, I've gotten to know that healthcare is at the center of this race, and getting another hospital into 8036 and like why they need it. I can't even imagine 24-hour to 36-hour wait times in an ER. Like, So you all, I will drop my contact information. I dropped an event. We're doing a comedy fundraiser on Friday night. You're all invited to join us in person or on Zoom. But also, if you want to connect with Jetro, schedule meetings, anything, build power together with us, just hit me up. I'm going to drop my contact info. So just want to put that out there, and love you all.
Wonderful. Thank you, Francis. Since Getro is one of our endorsed candidates, please do send us information about events, and we will post them in our newsletter and on our Facebook and on our website. So do send us whatever you have. Speaking of that, we also have this weekend for our another endorsed candidate, Fatima, Sunday. She has an event on Sunday and an event on Friday as well. So you can check out her website. It'd be Fatima Iqbal Zubair. Maybe if you have the link, Paul, you can drop it in. I'm not sure if you have that one handy.
What link is it? I'm sorry.
For Fatima's campaign. And then also Pilar Chavo is having an event with the San Fernando Valley Healthcare for All group. So if you go to Healthcare for All San Fernando Valley and look them up on Facebook, and you get information about Pilar Chavo's event with them. And then we have also coming up December 2nd, Shigeru, you told us about it already. It's fantastic, but put it on your calendars, everybody. You may want to really be part of that meeting. And then December 5th is, Sean, you're going to have to tell me, I always pronounce it wrong. I say Cyclavia, but I think I'm wrong.
Oh, I love it.
Cyclavia, like,
what is
but
it?
you were very close.
It's, what is it?
Cyclavia.
Oh, Cyclavia.
So, like,
okay.
yeah.
Can you tell us about that?
So Cyclavia is the largest open streets festival in the US, and it's right here in LA. It's back swinging, and it's great. They close off miles of streets, open it up for bikes and pedestrians, invite local businesses to kind of come into the streets, and also kind of set up something, and also community groups. So this is a great opportunity. We are looking to be there and be a presence for CalCare, and do it in an engaging setting where people are out having fun, and we're spreading a message about something that they already support. So many of our fellow Californians already support on this issue. So we're just gonna spend the day meeting them, and we're meeting them in an important district, or two important districts. That's Reggie Jones Sawyer's district. He's not yet a sponsor of AB 1400, and Isaac Bryan, who we have it on some good authority that he's going to sponsor just as soon as he can. But we still want to talk to his constituents and have them talk to him. So yeah, we'll be out there at Cyclavia having fun in the sunshine, hopefully, just the very beginning of December. So if you want to come out, that's probably going to be one of our most fun events in the next little while, or the one that means the most to me, because I always love participating in it, but especially if I have something fun like this to bring to it.
That's wonderful. Anybody else have any other comments or announcements?
I just think in closing, I just want to let everybody know, if you go to hcala.org, we'll have all of these events on our calendar. So that's your one-stop shop to find all of these incredible events. Very exciting. Would love for you guys to join us at HCALA. And if you liked what you heard tonight, put 5 on it. So just go to hcala.org to donate, join, and check out the calendar of events for all of these great upcoming actions. Thank you, everyone.
Thank you, everybody. You are the heroes of this movement. It really is the grassroots. That's where it's going to happen. We don't have the carrots, but we have the grassroots, our little reeds to let the legislators know we're here, and we're not going anywhere because we can't.
No, we can't.
We need healthcare. So if everyone could unmute and say goodbye and good night.
Thank you, everybody.
To everybody.
Bye, thanks.
See everybody soon. Have a good night.
Bye.
Thank
Good night,
you.
y'all.
Night.
If not,
Thank
it
you
was-
so much.
Good night.
Appreciate meeting you all. Bye.
Bye. We'll see you at office hours on November 7th. Bye-bye, everybody. Thank
Happy
you.
Halloween.
Yeah.
Bye-bye.
Bye.